Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
Today we will be talking about vaginismus and why we should consider the pelvic floor muscles.
What is vaginismus exactly? The muscles around the introitus tighten in response to attempted insertion or actual insertion of anything into the vagina, a sex toy, penis, finger, tampon. Your patients will describe that when the introitus is touched, they feel extreme burning, pain, and this can cause tons of anxiety. Sometimes patients will say that they feel like they've hit a wall.
And most patients with vaginismus have hypertonic pelvic floor muscles in resting position. If you're not able to perform your pelvic exam because your patient has pain, this tells you a lot. Take a deep breath with your patient and let them know this is telling us a lot right now, and there is a root cause for your pain. We will get to the bottom of it together.
All right, so how about we try a bulbospongiosis release? Remember, the bulbospongiosis muscle is the muscle that lines, it's right where the whole introitus is. So take your index finger and your thumb and take the tip, right? So just go in to your DIP and you just want to, with your gloved, lubricated finger, obviously, and with patient permission, and you just want to go either on the right or the left side and just gently sink in to the muscle. So it's not a pinch and you're not pressing really hard. It's just this gentle sinking in as if you could make the nail bed turn white. And then what you're going to do with your feet on the floor and you taking a deep breath, and both of you taking, you and your patient taking a deep breath together, you're going to gently just start to pull or lift. Imagine you're lifting the labia literally off of the vulva. You're separating and you just gently pull and you breathe and you maybe count to 10 long breaths, the equivalent of 60 or 90 seconds. That's enough time, oftentimes, for that muscle tension in those introital muscles, that bulbospongiosis, to just start to let go a little bit. And as soon as they start to let go a little bit, then you might be able to get in a little bit farther and deeper into the pelvic bowl to continue on with your pelvic floor muscle assessment.
And that's a wrap. Did you like this video? If so, hit like and subscribe. And please share with your colleagues. Comment below to let us know your biggest challenges in providing care for your patients with vaginismus.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam, where you'll find even more details about that bulbospongiosis release. And you'll get access to our weekly pelvic health content.
Be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce we're developing an online pelvic floor course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.